بدينا ب 100 بدينا ب 1971 اوكي بدينا في 1971 بمركز واحد. الآن عندنا 182 مركز بتاع الوصيل. This is the idea of telling you this slides. في المملكة 182 موزعة على مناطق المملكة كلها. دي اللي شفناها. احنا we can go quickly because we have seen this. Prof, we can go for our last prof where we stopped. Our last slide where we stopped. We can go. We can. Now نحن عرفنا عن الدورة والأعضاء، عن أنواعه، عن الأسماء ذكروها deceased retriever دي كلها، لأنه هنتكلم الآن عن الدونر أكشن. دونر أكشن أنا أقصد from the day عارف إنه وفاة دماغية إلى ما يزرعه الدونر أكشن كامل أو critical pathway أو donor process. All these terms I'm going to use in this talk. Okay. This is in short summarize the donor action. Here we are in scot transplant center. عندنا موبايل تيم donor hospital I mean المستشفى اللي فيها المتبرع، وترانسبلانت كوردينيتور we have نحن منسقين لزراعة الأعضاء أيضا أطباء أو إداريين، وعندنا regional coordinator ده الموجود. These are the things which I said in the point that we'll talk about the possible eligible or potential or actual. I don't have to. This is chart also done by Transplant International European Society. Maybe this it will be made for the research, but it's good to know it. And I'm going to talk about it stepwise. فأنت بتبدأ من ما أنت شكيت فيه إنه في حاجة ونبدأ بها. Donor action. قلنا donor action, donor process, donor critical pathway. من بداية كيف نعمل التنسيق من أوله، وكيف انتوا يا مركز تحصلوا على الاعضاء، ومين بيكلم مين، دي كلها احنا عارفينها الان. دورة الديتكشن، كلمة ديتكشن معناتها identification معناتها you know detect identify clarify not certify clarify. We'll start with شوف any ICU doctor when the patient RTA comes to his hospital and check the hospital, one thing very important, 6 hours should last from the time of trauma till he diagnoses the case. Very important. ER. So now we'll talk about detection. After 6 hours we'll talk about it. Detect once a doctor in the ICU came in the round and he opened, see the file, opened the pupil dilated, and see there's no reaction to light, few signs, that we call him a possible deceased organ donor. A patient with deficiating brain damage, حاجة كبيرة كده كانت محطوطة دماغه، or lesion or with circulatory failure, and apparently medically suitable for donation. Apparently يد احنا ما عارفين suitable or not، فبنسميه possible. لما الدكتور ده يجد الحالة دي أو شاف المريض بالمواصفات دي عنده برين دامج، ده اللي احنا عاوزين نعمله، يبلغ المركز تنفورم سكوت. بس هو بيشوف المريض أول This aortic score should be deep, less than 5, ventilated, pupil dilated, and he tests the brainstem. وجد المواصفات دي فيه. What I need from him is to notify or refer. انت تعمل للمريض ريفيرال، انت بتعمل له ايه؟ تحوله. هل احنا عاوزينه مش يحولوا يجيبوا لنا يدونا بلاغ انه there is a potential blindness. There is a possible blindness. So once he got it, he has to notify or refer. Tell us that there is a possible blindness. Where? To scot. We have free to telephone, and we have our telephone, fax, and email, and everything. All the 160 hospitals, they communicate, they call us daily. But we do not wait them till they call us. إن التيم فريق هتشوفوه لما تاخدوا الزيارة. النيرس ده بيكلموا يوميا المستشفيات. Hello, how are you? Is there any blindness in your ICU? والممرضات والأطباء بيزعلوا انتوا ليش بتفتشوا على الموتى؟ ممكن يسكروا فيكم التليفون. احنا ما بنفتش على الموتى، احنا مضغوطين من جهات، عندنا عدد ضخم من فشل الكلوي وفشل الكبدي وفشل. فعندكم بريندس يعني ما حتقعد عندكم الحاجة بتاعته، كان عندك الحاجة دي ما عندك. لا، احنا عاوزين بريندس لأنه عاوزين أعضاء للمرضى. They call us by the telephone, we call them to scope this our building from our side, and once they give us the report, we take the name of the donor, the information conveyed by whom, treating physician, age بتاعه very important to us. Whether she or he is important. يعني ميول عارف انها ميول فيميل؟
إذا كدني بس إذا كدني وليفر لا.
يعني ده تقول لي إنه الكدني بتاعت الفيميل ما بتصلح للميل؟ لا. في ثلاثة زي دي يعني الجندر فيها لها علاقة؟ لا ما لها علاقة. ففيميل برضه بنعرف whether she or he, and nationality, medical record, occupation very important. Why occupation is important is medical. Yes, whether we expose or not. We need to, in your history of medical history, when you go for clerking, you have to get this age and nationality, what he habit, what he is habitual to any other things. And when they take the diagnosis, whether مش في هنا ماركر؟
سوري فور ده عندهم هناك ولا عندهم هنا؟
عندنا هنا.
يعني هم
These are
they dictate to you by phone. عندك هنا فوق الدائرة الحمراء دي ايوه.
أنا شايفها. Okay, here is the blindness. The cause of blindness. Dr. Lucario will talk about. But here we record whether mechanical, cause of the blindness, whether mechanical as circumstances of this. Like there was a case of a girl who had some drug, 13 years young girl, عندها مشكلة معها فشي had 30 tablets. فنحن بنسأل okay she took the tablets حصل لها أي حاجة. This is what is the circumstance? How this took place? Is it by suffocation? Is it by? These are details of the cause of this circumstances, this mechanism of this. We have to know this. We record it. We record specifically each and everything concerning this patient. The reason is you may take these organs for a diseased donor, a diseased recipient. So you need to have a good organ, a good kidney, a good heart, and good liver. So to record each and everything. Who did the diagnosis? First test done, second test done, everything, diabetes, hypertensive, renal disease, CAT scan, very important for us. We record it. Whether he's having chest tube or not, chest trauma, and then we go for therapeutic medication. Anybody can tell me why should I take? He's dead. Why should I ask about this therapeutic medication? That's okay, accept it. Then
What medication you receive?
like okay, accept it. Another. Suppose this patient what is the cause of his death. If he is taking that drug and that drug masks the condition, I have to stop either this drug or check it in the blood and know if that drug causes his coma or his death or not. You know, we have to go back now. The difference between, I think Dr. Ghali will tell you, the difference between coma, brain death, and vegetative state. I leave it for him. So we have to go take the drug. And if the drug is high, we have to check the blood level. And if we could not check the blood level, I have to wait for 5 days till the last drug goes from the blood. So I'm very keen that I should know the drug. I should know how dose he's taking. Because when they ventilate him, they give him muscular relaxants, they give him some drugs. I have to know the drugs. I will go for this fluid intake, balance, and I will go for serology. Do you think that you can give a patient with hepatitis C or B to a donor, to a recipient? Why not? Really? You can.
You'll give him the infection.
But I will give him infection. You are right. And why should I give him infection? And what will happen to him? I'll give you 2 hints. Now, if hepatitis B, I could transplant it to a recipient B. C to C, B to B. Agreed? So could be. I could not give positive to negative.
ممكن يكون عنده different strain the same.
ما يعني مثلا هنا ما في هو الريسيفن اللي في الدياليسيس سنتر في الشميسي عنده هيباتيتس بي والدونر بتاعي عنده هيباتيتس بي فأنا give him add more anything. Like hepatitis B to negative patients, you will flare up the infection by cyclosporine and drug immunosuppressive. So positive to positive. But can I give HIV to a donor, to recipient? Never. You cannot. So the HIV donor could be unfit, and that will be given in evaluation and viability of the donor by Dr. Bishop in the coming days. So لأن في حاجات أنت ما بتقبلها خلاص. brain tumor في أشياء هتاخدوها يعني I don't need to talk about it now. لكن you can give hepatitis B to B, C to C. ما تقول لي ما كنت أتوقع واحد يقول لي HIV to HIV. ما قال حد. Okay. So we have to ask about this. Hepatitis C, cytomegalovirus also important for us. Even malaria, tuberculosis, brucellosis, viral disease. These things are very important. And drug also, I have to know it. Suppose this young boy, he's addicted, and he was taking heroin or drug, and he was driving and he died. I have to check this drug. أنا ما حاخد إنه cause of this كان الأرضية بس. هفكر في إنه he might have had some drugs that is a killing thing.
One question for you and one question for them. اللي فاتت دي اللي يسموها الدونر evaluation.
دي الدونر داتا. brain death potential form الدونر بتاعتنا احنا اللي بناخد منه كل المعلومات.
مع نفسه في الدونر action.
الدونر action yes.
You evaluate the donor for suitability for that.
Yes.
suitable donor هذه evaluation حق الدونر.
بنسجل فيها أي حاجة.
You do it there.
I will do it.
السؤال لهم هم أنا because it's a field of interest بالنسبة لي أنا. اللي هو cause of death هو كاتب mechanism وcircumstance. واحد كتب لي في cause of death في death certificate road traffic accident.
هذا المين كوز.
كيف المين كوز؟
الميكانيزم
هذا الميكانيزم ولا الcircumstance؟ هذا الcircumstance.
Because, but what happened? What resulted from the traffic accident?
What resulted is the mechanism.
Skull fracture or hemorrhage, arrest.
ولا air embolism ولا what was the cause? Eruption disbelief. This is the real cause. This is the mechanism. Road traffic accident is the circumstance. لكن في الديث certificate في مكانين ولا مكان واحد؟
مكان واحد.
So you are supposed to write the cause of this, the mechanism of this, not the circumstance. والناس بيخطئوا كثير جدا ان cause of this road traffic accident. ما هي مظبوط. anyhow عندنا في الدياجنوز النقاش ده وهنجيب death certificate و
So RTA, this is circumstances. Where was what causes his death is التروما النزيف الموجود.
هذا the cause of death.
هذا ده اللي عمل له cut the blood supply CAT scan, he had a trauma to the brain, irreversible brain damage or no. I have to make sure that CAT scan is there. Without CAT scan, we have never taken any donor. Okay. Now, نحن في identification تكلمنا عن identification و notification و referral. طيب ايش اللي بخلي انه الناس ال ICU doctors do not refer for us this donor to scot؟ ليش في gap between الاثنين؟ هذا الناس في late identification وال ICU doctors are very busy, they are not identified, or they are hesitant, ما عندهم معلومة, depends on others, ما بيتحمل مسؤولية responsibility, shortage of bed يقول والله في بيت كتير خليه روح، وفي transferring to intermediate، في intermediate and step down ward في ال ICU، ففي زحمة حيقول حول intermediate، ده اللي بيحصل. Some PA doctors they don't believe in this. Miscommunication and miscoordination is a big problem for us between scot and ICU. These are the causes of notification. Now, we have done the referral, we know the cause. What we are going to do now, diagnosis. We go for diagnosis, and the doctors will come, and if they did the diagnosis and they made the first test, that means this person who is clinical condition suspected to fulfill the brain death criteria, this is possible. قلنا this potential possible احتمال. البوسيبل ده بالعربي شنو؟ يعني ممكن potential لا عنده clinical قابليات، عنده clinical criteria.
هذه انتم دكاترتكم ترسلوه، انتم ترسلوا الدكاتره من هنا تودوهم؟
لا لل ICU.
ناس ال ICU اللي في المستشفى نفسه.
They communicate with us. This is the coordination. This is the organ process.
ايوه هم اللي يسووا
Exactly.
هم اللي يسووا الكونفرميشن حق
بالضبط كده. We don't go and do it. نحن لو مشينا عملناه بيقولوا لنا we are biased. يعني نحن we cannot go and do it because we are going to take the organ to the other transplant center. So the treating doctor who is doing the treatment for this patient is the one to do the diagnosis. ما عنده irrespect of organ donation. ما عنده علاقة بالorgan donation treating doctor. فبيعمل انت كطبيب مش عاوز تعرف the end result of this patient whether he is alive, you are dealing with a live patient or dead. بتعمل له examination وتكلم الله اذا كان هو حي ولا ميت. فالطبيب المعالج irrespect ما في اي علاقة بالتبرع بالعضلة. نحن لنا علاقة بالتبرع. فهو بدون اي علاقة بالتبرع يعمل التست دي اللي هو يبدا بالشروط، بيبدا بالشروط الشروط بتاعت الكريتيريا دي، وحيتكلم معكم فيها دكتور القاوي، بس يهمني انه انا ده فيرست تيست ويعمل نفس الفحوصات دي كلها هتكلم عن الدكتور. Exclusion criteria very important, drugs are very important. We have a lot of things which is going to talk about coronary reflex, and he should sign for us. Without signature, I will not accept. Without his name, I will not accept him. Okay? He did the first test, he go for EEG. Electro? He go for EEG and will find what if his brain is flat line. If there is an activity, you see it. So, but the question is, this will demonstrate what in the brain? No. It will give you the result of what in the brain. Brain field, cortex, stem field, the cortex. This is for the cortex. But it give you a clue whether this patient is dead or not. But the best is clear cut here. No circulation going on. Nicely blood flow here. So make a normal cerebral flow, absent, clear as we say that الخروف لما تسبح blood supply will not go. Blood supply is cut there by edema, by trauma, by blood, by tumor, by anything, and the brain died. Okay? So this is another confirmatory test for brain death. You go for another one. We go for another one. Perfusion scan. See? Nicely, there is no perfusion here. pass before the first test. So do the first test, do the second test, the same examination we repeat. But finally you will go with this, which will be discussed later, apnea test. And that is the most confirmatory test. Patient is ventilated donor. وانت طلعت الجهاز منه هيحصل ايش؟ ده التست الاختبار. راح نناقشه مع الدكتور القوي. ما هنناقش فيه. فابنيا test will tell you that this patient cannot breathe spontaneously. بعد الفحص الأول وعملت الإي جي، الفحص الثاني تعمل أبنية. شفت؟ لأن it's very strict يعني European is different. No EEG maybe first is clinical finish. But in Kingdom it's very strictly the most hard difficult criteria for in the Kingdom. ما لنا نخطأ. 9,500 plus case in the brain list we have no fault so far. Science good. The test should be done. Apnea test finally signed by the same doctor. That means this test is repeated how many times?
Two times.
In the first test, 2 doctors they did. The second test, 2 doctors did. And once he completed this documentation, he should send it to us. We keep it as a record with the file of the donor. We keep this record. And once it is diagnosed, apnea test is done. And you may fail to do the apnea. Dr. Ghawi can discuss it medically. He should sign it. Now, أنت عملت complete documentation. Documentation means you documented. You certify that this is dead. That is called eligible donor, a medically suitable person who has been declared based on neurological criteria as stipulated by the law of the jurisdiction. اللي هو اللو اللي احنا عملناه انه هذا eligible. eligibility كلية الطب this is eligible. now هو خلاص eligible. That will be sent for us by fax also. All documentation should be sent to us by fax. Now ليش الدونر دايما كان potential ما صار eligible؟ هذا delay في diagnosis or inadequate protocol ما عندهم EEG, failure of the apnea, bad maintenance, which is very important, we will talk about later, inadequate number of physicians, miscommunication, miscoordination is our problem. Again, there is a gap here. Okay? And now, causes of failure to complete diagnosis either إنه فيها rest وكثيرين بيحصل لهم rest within 1 hour, 2 hours, or 2 days documentation not completed for a reason or another. And donor management we will not talk about. This will be given a full separate lecture. هي ما هياش فقط you give the donor you report it to cause. No, you have to follow this case. I need a good kidney. I need a good liver. I need a good eye. Even the cornea you have to give some ointment for it. So we need to give drug. You know about dopamine, Domitrix, and all these things to build up the blood pressure. You have to maintain a healthy, good, as if he is a live person. And this is our main point. Keep your eye on this donor as if he is alive. Treat him. Treat him as if you are treating live. This is a follow-up chart which we are doing, the blood pressure and creatinine and admission, urea, liver function, AST, LST, all these daily basis. Day and night we call the ICU and take this record. Why? To make sure these patients, the donor is good, yes?
المينتنس والمانجمنت هذه تسوونها قبل ولا لما تخاطبون العائلة تاخذون موافقة؟
The day the suspected brainless we saw it. Till the patient is arrested or the donated, harvested. We keep on.
هو سؤاله انت will start maintaining حتى قبل ما تاخذ موافقة العائلة ولا بعد ما مش كده؟
ايوه.
ما تفتكر انه العائلة هم عاوزين to be maintained؟ يعني العائلة لو جو زي العائلة مرة قالت انتوا وقفتوا الدواء ده ليش؟ البيشن حصل له حاجة. الأم جت قالت في تمبريتشر كيف هو ميت وفي تمبريتشر صباحها 35 ومسها 36.
إذا كانوا مشكلة في فصل الأجهزة.
هذه فيها فتوى حنعطيكم كتيب عن دورة العمر. كتيب كامل عن الفتاوى دي.
يعني أنتم تشيلوا الأجهزة والعائلة معارضة.
أنا انترستد في كلامه ده جدا. maintenance, you start maintenance of an eligible donor even before getting the consent. مش كده؟
Yes, we
If
do.
you don't get the consent, will you stop it?
This is good, another one. But we'll go for the first question here. We start the day he entered the ICU. You start managing the patient, hoping that the patient will will come out of it. أنت كطبيب will keep on treating till the last thing you can do in your job. Do your best. Give the patient the benefit of doubt. Treat whatever, all hormones, therapy, anything you need. Give him the drug, the maximum, and keep him on after this. Confirm this. The question will come here: why? Somebody, by medical student, nurse, he is dead. Why are you maintaining him? خليه يمشي. يقول له زراعة الأعضاء هتبقى مشكلة في إنه إحنا مضطرين. خليه يمشي، أعطونا إكرام الميت، دفنوا، أعطونا الميت، خليه يمشي. في بتحصل الكلام ده. السؤال ده is very valid بيجي مع الأهل. إذا أنتوا هو ميت ليش بتدوه أدوية وبتدوه؟
لا، هو نحن دلوقتي بنسأل عن العكس، إنه أنت بتتعامل معاه as a eligible donor قبل ما تاخذ الكونسنت، مش كده؟
أيوه.
لأنه أنت مضطر تعمل كده
عشان تحافظ على الأعضاء.
لا تحافظ على الأعضاء. You have to do it.
مو للتبرع.
بعدين لو هو قال له لا، ده موضوع ثاني. أنت you hope that they will say yes. You have to maintain. لأنه if you do not maintain, you lose the organ.
But I will complicate you more. Now, if the donor, if the family said, well, why did you give him treat his potassium low or high? Was it that one of the cause of his death, cardiac death, something like that? That happens, but rare. But anyhow, you have to maintain the day he entered and to continue whether the family agreed or not. Okay, agreed? Is clear? Yes.
Who did the first commentary?
Huh?
You were the one who
No, the ICU doctor. ICU doctor. And we continue, record this follow-up sheet daily and night. And now you have done your treatment, continuing treatment. What are you going to do for the family? لو انت عندك قريب لا سمح الله عنده اي مرض معين، هتوصل المعلومة كيف؟ That is breaking bad news. I think we'll have a break to break that news later on. So you will have to break that or continue. لأن هناخد بريك. أنا ممكن breaking bad news نعملها سريعة لأنه هناخدها في محاضرة ثانية. So you have to break the news to the family. يقول لك واحد خواجة عنده ضوء عزيز عليه وكلب عزيز عليه، فاداه لصديقه وقال له يا أخي امسك الكلب ده، حرص عليه فسافر. صاحبه رسل له وقال له الكلب بتاعك مات. فزعل قال له يا أخي المرة الجاية يعني أنت المفروض تديني بالدوزز يعني. كل الكلب طلع هرب، ده ضربت السيارة وديته وبعدين يقول لي ما تديها لي كده على طول. فبعد كم يوم اتصل عليه وقال له والدتك تعبانة شديد. معلش والدته فهي دي الدوزز اللي انت عاوز تديها له الدوز. But practically speaking انت بيحتاج ل somebody who knows skill for this. How to approach, what to say, how to say. ففي الأطباء بيخافوا شديد من إنه يكلموا هذا. Breaking bad news is a problem. We will talk about it later. But I'm afraid that we are going to repeat this. How can we play this? I don't know.
هو موجود؟
أيوة.
وين موجود؟
موجود هنا.
ما موجود هنا. ولا رايكم شنو التكنولوجي شباب التكنولوجي؟ If you insert a video, you have to copy it with you.
I didn't know how to do it. I admit I didn't know how to do it. I attended 1 year ago a workshop with him in Sudan, and he taught us how to do it, and yet I didn't learn. This is my fault.
He copied the presentation. He did it, packaged it for.
But when the technician who came here, he did it yesterday. He said, "Now you can play it." I thought I would click here and play. Anyhow, since I am going to give it in another lecture, so forget about it. Okay. So this is the breaking news. Okay. So quickly, what is the importance of breaking bad news?
Excuse me, ممكن معلش بس ترجع للباسويز. النقطة دي يعني مسج to the family دي.
Yes, yes. It's a very good. Thank you, Prof. Yeah, very important point. When you diagnose, you declare. You convey the message. But when I said in giving in doses, when you do the first test and you know that the end result of this donor is brain death. So when the family come and ask how's he, ما هتقول لهم تعبان ولا seriously ولا comatose. هتقول لهم والله في another test we are going to perform. This is the doses which you are talking about. For once it is complete diagnosis, second test, after it is positive, then you tell them that he is having sustained an irreversible brain damage. This is a message which is connected with the diagnosis, as the Prof said. Yes.
I think we can solve the problem for maintenance or family questions for the doctors why you give this medication or this. If we do breaking bad news this in this order, message to the family can be before many immediate.
But yeah, as the professor did drop me for a very important point. Here, this is not one, two, three, but this one, management, it should be anywhere here, after detection, and here, management in each and every step you go.
No, I mean the maintenance to maintain this patient to be able to be.
We better not tell them the family that we're maintaining it for organs, because from the start we said, don't maintain it, we don't want to donation. Better not to.
Socially speaking.
Yes.
يعني والICU doctor should not talk at all about donation.
Should never talk about organ donation. Treating doctor should never, yes.
المينتنس واللي يسوي
هذا الICU doctor, treating doctor.
ما يجي عندهم تعارض مثلا يقول ما ابغى اسوي ولا.
No, never. He cannot. He's a treating doctor. He has to continue his job. He has to continue his job.
انا عملي اني سويت التداول وجدته ميت خلاص.
هيجيك ناس كده بالمناسبة. قال لك الICU دكتور ممكن يقول لك يا خلاص ما انا مالي شغل بدونيشن، لا لكن هو قال لك عندهم معاهم اتفاقيات ما ادري ايش ولا لا.
والله هو دي خلقت لنا فعلا مشكله كبيره في انه الدكتور يعني باي the memory الورق اللي طلع من وزير الصحه ومن وكيل وزاره الصحه ومن المملكه. انت as a doctor you have to maintain report, continue this job, part of your job. No doctor can tell this. We'll fire him out. Believe me, we'll do it. We did it for some doctors. He cannot. He may say, well, he may argue with you. This is not brainless. والله to me this is no coronary reflexes positive. He is still alive. وأعطيبك كثير من الأمان. He can discuss with you. تعال ناشطب تعال. Let us do it together. You're wrong. Yeah, I'm right. ممكن يعمل كده. ممكن يعمل other things. يوقف supplement when patient will fade away. He doesn't believe. If he does not believe in brain death per se.
لا هو نقطة كمان اللي احنا انترستد فيها خلاص هو اقتنع انه برين ديد بقى بعد كده موضوع الدونيشن ده بيعتبر not part of his job. ما مقتنع بموضوع الدونيشن وايش يسوي مينتنس كده ممكن وقال لك لا لكن القانون هو ملزم انه يتعاون مع السعودي سنتر فور اورجان دونيشن ويعمل المينتنس وكده. ده ما بيمنع انه في بعض الاطباء يقول لك يا اخي
بيعملوها لكن احنا we know how to deal with it by now. We really know how to deal with it because this is the reason is this is a national job. حاجة وطنية كاملة قائمة على المملكة ما حد يقول لنا لا.
بس بالنسبة للمستشفيات الأهلية الخاصة.
هي بتدرس.
من بيتحكم في
نحن معه. هو هذه مشكلتنا. طبعا إذا كان تبرع نحن بنتكفل بالإكسبنسز اللي عملها في الICU. وإذا غير تبرع بترجع لأهله وللتأمين بتاعه.
وإذا أهله قالوا ما بندفع شيء.
هو ده بعد قلت السوريين يصطفلوا مع المستشفى. هو المستشفى مع بعض. لكن احنا إذا تبرعوا بنحاول نتكفل
ما في جهة.
لأنه أنا قبيت ذكرت صراحة إنه في كوست يعني بتكلف حاجة مرة كتير في هنا. فاي باي 50,000 وانسى 100,000 ريال. برضو ما في شيء كتير لكليتين زرعوا وقلب وكبير كده. I will than 7 million ريال. mind you الكلية ليش المريض بيكلف برا المبلغ ده؟ يمشي يذاكر ويدرس ويأجر ويدفع المبلغ ده للمركز. و they keep him in the waiting list for a month or 6 months. واحد كان جاني في السابق كنا نحن اللي بنرسل المرضى في الخارج. فأنا تابز إنه كتبت له الأوراق قبل كم سنة وسافر. بعد سنة اتصل علي كيف الحال؟ ليش؟ الحمد لله السلامة زرعت. قال لي لا والله أنا في إجازة. إجازة ليش؟ قال لي ما لسه الكلية بتاعتي ما جات. فقلت أجلس وأرجع لهم تاني. سنة قاعد في أمريكا منتظر كلية. وباي ذا واي يعني هم هناك فيرست فور أمريكانز أند ذن الباقيين. ولما يدوك شنو فانت هنا لما تعمل ناشونال بروجرام زي دي وتسيف ذيز اماونت للناس وللامه ما في شك.
بالنسبة للاتصال على العائلة وتقديم الخبر اللي يعطيها الدكتور اللي في الاي سي يو ولا اللي تعطونه انتم؟
بالنسبه للتبرع وبالنسبه للنيوز النيوز اديها الطبيب المعالج لله وما يتكلم عن التبرع. ما يتكلم عن التبرع بس يقول لهم انه صار له ريفرسبل برين دامج.
يعني ما يستخدم مصطلح ليه؟
لا يستخدم الدونيشن
بالضبط كده.
تقعدون فترة طويلة بعدين تكلمونه العائلة ولا على طول؟
هذه حنتكلم عنها بعدين اللي هي انت بتديهم فرصه تو ابزورب ذا شوك كده. في حاجات في I think we go quickly for breaking bad news و we have to skip all this to talk about.
لانه في بعدين في السوشيال دايمنشن another 2 weeks.
Okay, so we leave this. We go to a point where في فيلم زي ده هنشوفه إن شاء الله. These are what I'm going to talk about in the future. But أنت دلوقتي تكلمت اللي عملت breaking bad news. عملت breaking bad news. إيش what is next؟ الآن بعد ده هتجيب واحد إداري عشان يكلمون عن التبرع بالأعضاء ووافقوا بيكتبوا لك التبرع written. Okay, موافقة written to be given. I wish you could go quickly so that you cannot repeat.
بس متأكد المشكلة في
اوكي خلاص ما في اشكال حتى لو repeated no problem. It's okay. فبنجي لحاجة مهمة وهي بعد كونسنت حصل ايش؟ إذا شفت أنت السلايد on the right side it can go quickly or I don't know how. Escape it so that we cannot repeat ourselves.
كتير بقى كتير في السلايد.
هاي فيها شوية نديها خلاص شوية. جيبه on the right side. If you عشان تكلموا بالتبرع تنادي واحد إداري بيعرف كيف how to talk with the family. وفي فرق